Good afternoon. It's very nice to meet you. My name is Dr. Faye, and I will be your commodometrist today. Commodometrist coming from the Latin word commodus, meaning comfortable. I'm told that you arrived here at the hospital yesterday presenting symptoms that are relatively consistent with a severe lack of comfiness and physical touch. We get cases of touch starvation far more frequently than you would think. So not to worry, you're in very good hands. Now, I know you've probably answered a lot of these questions yesterday, but I'm going to have to ask you some of these questions myself, just to hear it in your own words rather than from a piece of paper or a screen, and just to check if anything about your condition has changed. I see that the staff on site last night did provide you with a set of plushies. That is, of course, a useful first step, but it certainly can't completely remedy the condition all on its own. Now, to get started, I'd just like you to describe for me how you're feeling right now, if you're experiencing any pain or discomfort, physically or emotionally, all right? Okay. Patient expressing feelings of loneliness and disconnect. Understood. Feelings of exhaustion, lethargy, lack of motivation. Okay. All right. Well, given what you're describing, I would say that this is all pretty well in line with what we typically expect from a case of touch starvation. So I'm going to run a few tests just to make sure. I want to, make completely certain that we're treating the root cause of the issue and not just the symptoms, So I'm going to, with your permission, I'm going to put on a pair of gloves. And we're going to do some gentle palpation. That is, I'm going to be touching you a few locations on your shoulders, your face, and your stomach. And we'll be gauging your response, all right? We have you hooked up to a monitoring system that should provide some very useful data that will help inform your treatment plan going forwards. Are the gloves necessary? Yes, they are for the sake of this test. So, to begin with, I'm going to touch both of your shoulders. All right. And as I do this test, I'd like you to describe for me exactly how you're feeling right now, okay? Feeling awkward? Understood. I appreciate you bearing with me as I do this. Moving over here once again. Touching both your shoulders at once. Now I'm going to be moving both of my hands up to your face. Okay, we are getting some interesting readings out of this. This, honestly is looking like a pretty cut and dry case to me, which is good news for you, because that means it's very, very treatable, okay? This is just about the most straightforward case that I think I've seen. And so we should be able to address it very, very simply, okay? Now, you might be wondering, why the gloves? Now, to be clear, in most hospital settings, when one is going to be interacting with the patient, touching the patient in any way, you'll usually be wearing gloves. A commodometrist, however, often involves barehanded contact in their work, which is part of why it's so very important to make sure that we've ruled out other possibilities before performing touch starvation treatment, because in the event that it is some other infectious disease, there's a higher likelihood of the commodometrist getting sick. But more than that, there's a certain reaction that individuals suffering from touch starvation experience, a certain physiological reaction that comes from physical contact with another human being. But that reaction can be a little bit harder to detect than physical contact through another medium. You see, when you're experiencing touch starvation, your body is naturally craving touch. It's a form of social exhaustion, a social deficit. And so, there's a type of physiological reaction that occurs when that need feels close to being met, but is not presently being met. And that is very, very easily detectable by our instruments. And so by engaging in physical touch through the medium of these gloves, I can elicit that response. That response is then picked up by our instruments. And that allows me to, no fuss, say with near 100% certainty exactly what's going on. And in this case, we absolutely do have a commodometry problem, a comfort problem. You are clearly showing the most obvious signs of touch starvation. And so, naturally, your treatment plan is going to address that. So I will be returning this plushie to you right here. Okay? I want you to hold this. Okay? Just hold on tight to this plushie right here. And with your permission, and within the bounds of your comfort, I would like to begin administering treatment. All right? Now, part of my job as a commodometrist is the mastery of certain techniques that are used for comforting and for alleviating touch starvation in the most efficient manner possible. However, touch starvation is a complicated condition that can rarely be fully remedied in a single session of treatment. And in fact, even if it does pretty much completely vanish by the end of treatment, without certain lifestyle changes and without ongoing care, there is a certain likelihood that it can relapse and reoccur. All right? So you're going to be visiting here for a good while. In the meantime, if you're all right with me beginning treatment, I'm going to gently brush out your hair for you. All right? You've been in the hospital all day, lying in bed. It's a little bit tangled. So I'm going to begin gently brushing it out. All right. And I'm going to run my fingers through it. Do you enjoy head scratches? You see, one of the most important aspects of touch starvation is there are certain treatments that are broadly effective. We'll be moving on to one of the more advanced techniques a little bit later, that being the snuggle. That's something that medically we typically only prescribe for fairly advanced and severe cases of touch starvation. But your case is certainly one that I would qualify within that branch. But the most effective method of touch starvation treatment is to establish what kinds of touch your patient usually prefers and to attempt to administer that. For instance, I once met someone who expressed affection through physical contact in the form of gentle headbutt, sort of like a cat. And so I very gently bonked my head against this patient a few times every hour for about a day, and then had that patient return after their shift at work every day for another few weeks to exchange a gentle headbutt with me. And they experienced a complete remission. So if there is anything in particular that you would enjoy more than anything else insofar as physical contact and affection is concerned, feel free to let me know, all right? Let's see. Okay. So you enjoy scratches behind the ear, head pats, that sort of thing? All right, that's very straightforward, isn't it? In that case, I've recorded that in your file, and I will just very gently lean in and take care of you, all right? As a doctor, it's my job to help you get better. That is exactly what I'm trying to do right now, okay? And I do this because I love doing it. You understand that, don't you? I find purpose in caring for other people, helping other people. And that is exactly what I intend to do. Touch starvation is a very serious condition that is under-researched and certainly not spoken about enough. It's good that you came in when you did, you know? It's a very serious condition. Am I only doing this because it's my job? Not at all. I understand why you would ask that. It's something I've been asked before. It's a common line of thinking among those experiencing touch starvation. People often blame themselves. They decide they must have done something to deserve their state of isolation. They believe that there's something they've done wrong, and, well, maybe there is something that they could have changed, could have done differently, but the past is the past. In the here and now, you're someone who is desperate for connection and who is not receiving that connection. And that's what I see when I look at you. Someone who needs connection, who needs someone to be there, and who hasn't been getting it. Do I do this because it's my job? Is that the only reason I want to help you? Not at all. This is my job because I want to help you. You see? It's the other way around. I believe that nobody deserves isolation, that nobody deserves to be completely abandoned, that even if you're isolated because of a mistake you made, you still deserve a gentle touch and a kind word. And having met you personally here and now, well, I am quite happy to be providing you with adequate medical care and helping you. I'm glad to do that. Now, we both understand that you understand that in order to prevent this from reoccurring, we're going to need to build you a support network of people who are willing and able to get close to you and to express affection through touch like I'm doing right now. But that can wait for later, all right? Right now, you need to be cared for. I am here to care for you. And I will continue to be here to care for you for as long as you need. And I, as a commodometrist, and as part of the medical staff here at this hospital, I'll be perfectly happy to help you every step of the way as you try to build those connections. Because I know that this process, it's a long one and a difficult one. So, with your permission, I'd like to move on to our final, most advanced method of treatment for the day, all right? It's very simple, okay? With your permission, I will be lying down next to you and wrapping my arms around you and pulling you nice and close, all right? Does that sound all right to you? The two of us can just stay there for as long as you need, all right? You're one of my only patients today, so I have plenty of time. All right. That's it. Just relax. Deep, deep breaths. In and out. You're gonna be okay. I promise. You're gonna be just fine. I'm going to have you stay overnight. One more night, okay? Just so that we can monitor you. Make sure your condition is nice and stabilized. And so I can administer treatment in as thorough a manner as possible. And tomorrow, when I send you home, I'll be providing you with written instructions and a prescription to return here for about an hour every day to continue your treatment, all right? Okay. You did a good thing coming in when you did. I am happy to be taking care of you.